Hi everyone. Today we are going to see about another nurse theorist, Virginia Henderson, and her theory, needs theory. The biography of the theorist. Virginia Henderson was born in the year 1897. Henderson's interest in nursing evolved during World War I from her desire to help the sick and the wounded soldiers. She died in the year 1996. She is referred as the 20th century Florence Nightingale, and also she is known as the modern day mother of nursing. She received her diploma in nursing from Army School of Nursing, Washington, D.C. in the year 1921. Later, she did her bachelor's degree and master's from Columbia University. She worked both on the service side and teaching side. She worked as a nurse, teacher, author, researcher, and health advocate. Her writings have made an impact on nursing throughout the world. Her major publications, if we see, are The Nature of Nursing, Basic Principles of Nursing Care, and The Nature of Nursing Reflections after 25 years. Her published work, Basic Principles of Nursing Care, became an international sensation. Till date, it has been published in 29 languages and is referred to as the 20th century equivalent of Florence Nightingale's Notes on Nursing. Her outstanding contributions to nursing made her receive numerous recognitions and honorary doctoral degrees from various universities. Henderson, she had three questions in front of her. They were, what is the practice of nursing? What is the function of nursing? And what are the nursing's unique activities? So, she also developed, you all know that she developed a definition of nursing which you have studied in the first year. How or why she developed this nursing definition is through these three questions. What is the practice of nursing? What is the function of a nurse? And what are the nurse's unique activities? Based on this, Henderson described the unique function of nurse as to assist the individual, it can be sick individual or well individual, in the performance of those activities. So, the nurse will be assisting an individual who is sick or well in the performance of activities, and these activities will contribute to health of the person or to the recovery of the person or to a peaceful death. So these things are assisted by a nurse because these things cannot be performed by the individual alone. That is what it is, that he would perform unaided if he had the necessary strength, will or knowledge. It is likewise her function to help the individual gain independence as rapidly as possible. So this is what nursing is, assisting the sick or well individual in the performance of activities which that person cannot perform by himself or herself. And also the person will be gaining independence as easily as possible. Henderson emphasized the importance of increasing the patient's independence so that progress after hospitalization would not be delayed, and she developed her definitions as a concept. Why did she develop this definition of nursing is because of two reasons. One is that she participated in the revision of a nursing textbook during her career, and also she observed that many states in the United States had no provision for nursing licensure. She categorized nursing activities into 14 components, and these 14 components are based on the basic human needs. Henderson focused on individual care. She told each person is different, so you have to consider all these 14 components for each and every person. She described the nursing role as assisting the individuals with essential activities to maintain health, to recover, or to achieve peaceful death. As already told, what is the function of nurses? She introduced the term basic nursing care. Nurses' role, according to Henderson, are mainly three. Like Oram, Henderson also has given three ways the nurse will be helping the patient. First one is the substitutive role, that is doing for the person. The second role of nurse is supplementary, that is helping the patient or the person. And the third role of a nurse is complementary, that is working with the person. So if the person is extremely sick, substitutive role, and if the patient needs a little bit of help, that is supplementary, and if the patient just needs some assistance, that is complementary role of nurses. These are the 14 components of basic nursing care which Henderson told. The first 9 components are coming under the physiological component, and the 10th component is the psychological aspect of communicating. The 11th one is related to spiritual and moral. The 12th one sociologically oriented to occupation. The 13th one sociologically, that is oriented to recreation, and the 14th one is psychological aspect of learning. So the first 9 things which comes under the physiological components are breathing normally, eating and drinking adequately, eliminating the body waste, move and maintain desirable postures, sleep and rest, select suitable clothes, dress and undress themselves, maintain their body temperature within normal range by adjusting the clothing and modifying the environment, keeping the body clean and well groomed, and protect the integumentary system, avoiding the dangers in environment and avoid injuring others. If we are dealing with the psychological aspect of communication, what Henderson told us, whether the patient is communicating with others and is expressing the emotions, needs, fears or opinions. The 11th one, which is related to spiritual and moral, is worship according to one's faith. Sociologically oriented to occupation is work in such a way that there is a sense of accomplishment. And sociologically oriented to recreation is whether the person is having any play or they are participating in any form of recreation. The psychological aspect of learning is the person learn, discover or satisfy the curiosity that leads to normal development and health and use the available health facilities. The same 14 components is explained here. You can see with the pictures: breathing normally, eating and drinking adequately, eliminating body waste, move, maintain desirable postures, sleep and rest, select suitable clothes, dress, undress, maintaining the body temperature within normal range, keeping the body clean, well groomed and protect the integument, avoid dangers in the environment and avoid injuring others. And these 9 components are coming in the physiological part. Something which is related to the communication. The person is able to communicate with others in expressing emotions, needs, fears or opinions. Related to the spiritual one is worship according to one's faith. work in such a way that there is a sense of accomplishment when we are achieving something socially. Then play or participate in various forms of recreation is also related to society. Then learn, discover or satisfy the curiosity that leads to the normal development and health that is related to the psychological aspect of learning. From all these 14 components and her concept, she developed the definition of nursing. So this definition should be by heart by all nurses. This definition was developed by Henderson in the year 1966. The definition says, the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to the health or its recovery or to peaceful death that he would perform unaided if he had the necessary strength, will or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. Definition of nursing and 14 components of the basic nursing care. Together they outline the functions of a nurse. Moving to the assumptions of the need theory by Henderson. Mainly there are 4 assumptions. The first assumption is nurses care for patients until they can care for themselves once again. This is what the theorist assumed before she developed the theory. So nurses care for patients until this patient can care for themselves once again. Second one, patients, they desire to return to the state of health. Every human being desires to come back to the state of health. Third one, nurses are willing to serve and nurses will devote themselves to the patient day and night. And the last assumption is Henderson believed that the mind and body are inseparable and are interrelated. That is why she has included both the psychological and the physiological components as the 14 components of basic nursing care. Moving on to the meta paradigms of nursing. Here we are just discussing the 4 meta paradigms: person, environment, nursing and health. First one, a person or a human. Humans are having 14 basic needs, and these 14 basic needs are included in the 14 components of Henderson. The second one is environment. She sees individuals in relation to the families. That is why she has told about how the person has to live in the society. But she has minimally discussed the impact of the community on the individuals and the families. Third one, health. Health is related to how the humans function. She explains age, culture, physical and intellectual capacities and emotional balance affect an individual's health. Nursing. She believed nurses need a liberal education. Along with using the 14 components of care, a nurse is expected to carry out the physician's therapeutic plan as well. She told that it is not only the nurses has to take the physician's orders only, but these 14 components also the nurses has to provide the patient while taking care. Nurses' creativity in planning care results in individualized care. So, nurse should have some intellectual capacity. She also expects to improve patient care by using research results. According to Henderson, a nurse must be knowledgeable. She should practice individualized care and must be a scientific problem solver. So this is a sample application of Henderson's theory. For this I have selected a 20-year-old female client. She was admitted with attempted suicide. She ingested poison. Upon history taking, she was reluctant to share the reason for her suicide, and her mother reported that she was an impulsive and emotional person. Her physical assessment revealed an alert, oriented but depressed female. Her chief complaints were difficulty in breathing and mood swings. Her CT scan endoscopy showed damaged larynx, mouth and stomach ulcers respectively. The dietitian advised a liquid diet, but she showed dislike and resisted eating. Due to her limited intake, Foley's catheter was passed for an accurate record of her daily intake and output. She had non-compliance with her intake and developed dehydration, irritability and insomnia as evidenced by dry mouth, sunken eyes with dark circles around her. So, this is what the history we have collected for the patient. And now, how to put up this in nursing process application. The first thing in nursing process application, here the Henderson viewed the nursing process. Here we need to approach logically to the solution to a problem. With application of nursing process, each individual will receive individualized care. So here, first in the assessment part, the nurse has to assess all the 14 components of her basic nursing care. The assessment phase is completed by analyzing those data from breathing normally till the last one, whether the patient is able to learn the things. So everything should be analyzed. The data should be obtained for all the 14 components. And the nurse requires knowledge base for this. That is, the nurse should know the breathing normally, whether when the nurse is going to assess that, the nurse should have knowledge about what is the normal breathing respiratory rate, is there any stridor, is there any other breathing problems. The nurse should be able to assess. With the assessment, the nurse formulates the nursing diagnosis. There, the Nanda nursing diagnosis can be used. Third phase after diagnosis is the planning phase of nursing process, and it is starting from the time of admission and it will end till the discharge planning. Plans to be modified based on the individual needs. Each and every person will be having different needs, so plans will be different. Physician's therapeutic care also must be a part of the plan of the nursing care. So these are the first 3 steps. The fourth step is nursing implementation. It should be based on the planning. And last, evaluation must witness a change in the person's level of functioning. A comparison should be done pre and post nursing care. From the assessment till the evaluation, some changes the nurse should be able to find out. All these steps must be documented for continuity of care. So let's see the sample care plan, how to write for the patient which we have seen. So the first is the assessment component. So the Henderson's component. The Henderson's component include that 14 components we have to list down line by line, and the next is the assessment part. There the first one is breathing normally or not. So what all things you have assessed in the breathing, we have to write. She experienced difficulty in breathing, respiratory rate is 16, it is irregular, oxygen saturation is 87. Then you need to move to the nursing diagnosis. Here, activity intolerance related to dyspnea is noticed, and the outcome is she breathes normally. So this is till the outcome. The outcome or the goal is the patient has to breathe normally. So the planning for this, what all things you need to do for the patient to breathe normally, you need to write, and the interventions. The second component you will take, eat and drink adequately. So here for the assessment part, what is the height and weight, what is the skin turgor, what is the diet, how is their intake output, everything should be written. There, after the assessment, you may write nutritional imbalance less than body requirement related to less desire to eat. And the outcome which we expect is she has adequate intake of nutrition. So based on all these things, we will be planning things like address all the psychological needs and provide respective nursing care, encourage the client to identify the strength and limitation, share her concern, help her participate in the activities of daily living, then discuss effective coping strategies and impulsive and control the behaviors like talking, and we should encourage her in drawing any pictures, asking questions for exploring her stress factor. Based on these plans, for all the 14 components, we will be doing the interventions. We will be observing the strength, such as the ability to relate the facts and to recognize the source of stress, monitor the risk of harming self or others, help the client set realistic goals and identify personal skills and knowledge, use empathetic communication and encourage client or family to verbalize the fears, express emotions and set goals. So like that, all the planned things you will do the intervention, and later on you will go for an evaluation and a comparison will be made between the assessment part and the evaluation. Hope you understood how to formulate the nursing process and what are the columns you will be putting. Next, the strength. The theory can be used in all practice setting, whether it is pediatrics or adult or anywhere you can use this. You can wrap all the components of the nursing process and all the steps you can see in the nursing process using this Henderson's theory. The weakness is the concept of holistic care is lacking, and the relationship between these 14 components, they are unclear. Each component is affecting other, but we don't know the relation. Then how the factors like age, culture, etc. affect nursing care, that is also not well explained. The characteristics of the theory, there are main 7 characteristics of the theory. In all the theories we have to mention this. First is theories interrelate concept in such a way as to create a different way of looking at a particular phenomenon. Here in this theory also, Henderson has tried to inculcate so many concepts together, and she has borrowed the concepts from other disciplines. Henderson's theory is logical in nature. The third one to tell this as a theory is it's relatively simple yet generalizable. Its shortcoming is lack of empirical testing to generalize the theory. Then, it is a basis for hypothesis that can be tested. As Henderson's definition of nursing cannot be viewed as a theory, it is impossible to generate a hypothesis. However, certain questions like whether all the 14 components are followed by nurses in any hospital, any priorities are evident in using the 14 components, etc., can be asked. So, that is hypothesis can be developed. A few hypotheses can be developed from this theory. They contribute to and assist in increasing the general body of knowledge within the nursing discipline through the research implemented to validate. It can be used by the practitioners to guide and improve the practice, and it is consistent with other validated theories, laws, and principles. Thus, to conclude, Henderson used the concepts of fundamental human needs. It's more concise and simpler to apply in the clinical setting. Henderson's definition of nursing called for the nurse to be an expert in basic nursing and to be an independent practitioner. As a novice nurse, this theory is very easy for a nurse to implement in the clinical setting. Once you know the 14 components, you will be able to assess that in the patient, whether we will be immediately able to understand where the problem is and how to help the patient, how to formulate a nursing diagnosis, and how to provide care for the patient. So if you are a nursing student going to the clinicals, try to take these 14 components and check whether the patient has any problem with any component. Try to develop nursing diagnosis with that and try to provide care. Thank you.